Tonight's video is all about what is the difference between a speech therapist and a speech language pathologist. My name is Hillary. I am a speech language pathologist who specializes in concussion and cognitive rehabilitation. So there's actually no difference. We are one and the same. I would consider myself a speech therapist as well. It is actually just something that is a bit more specific as far as naming. So around the 70s, our governing body, which is ASHA, American Speech, Language, and Hearing Association, they decided that speech therapists just did not give a full picture of what we do. And so they decided to start separating speech therapy to be speech and language pathologists. The speech and language part is because we do actually have separate things for speech and language. Language might be word finding and that type of communication, pragmatic language. Speech might be something like articulation and apraxia of speech. And so there are different things. So they decided that speech just sounded, it didn't give us the full picture. Even speech language pathologist doesn't give everything, because we actually do things like swallowing as well and voice therapy. So cognitive therapy. So there's a lot of things that still are not in that name that we have. The difference between, or why they added pathologist, is because we are actually able to diagnose treatment diagnoses. So when I am seeing a patient for the first time and I'm doing an evaluation, I will give them a treatment diagnosis. They might come to me with something like post-concussion syndrome, and that is the medical diagnosis. I cannot give that, I'm not the doctor, but I would diagnose something like cognitive communication disorder, and that is what I would be billing for. That is my treatment code. I am treating that disorder. It is not a medical disorder, but it does have its own ICD-10 code, and then we would be able to bill our CPT code for that. So the pathology aspect is because we can diagnose. I will say it is a mouthful to say speech language pathologist all the time. I'm actually not going to correct what the captions decide I say when I say speech language pathologist, because every time I do a video, I do tend to have to correct it, and I'd love to just let you all see what it thinks I say sometimes. Yesterday's video, I completely just messed up saying it, just kind of stuttered on the pathologist. It's a mouthful. So sometimes if you say speech therapist, I would never correct you. It's more colloquial now to say speech therapist. When I give my actual credentials, I need to say speech language pathologist. And Bear and I are going to go finish our walk. Have a nice night.